Oh wow. My goodness, that's just so much better. Wow.
Hello, I'm Naruschka. Today we will be welcoming Emma, who's coming to see me to treat her tear troughs. Now, for those of you who don't know, the tear troughs are this lovely area that runs from the inner corner of your eye and outwards to the central part of your cheek, and your tears naturally would run through that area, hence why it's called the tear trough. So for lots of people, this area gets super hollow. People want to look fresher, brighter, and rested, and this is a great way to achieve that. So Emma, just have a look in the mirror for me and tell me in your own words why you've come in for treatment and what you're looking for exactly.
So I've come in for treatment today because I'm really unhappy with my under eye area.
Right.
So when I was a child, I've had a lot of hollowness under the eyes, which I think is genetic. As I've gotten older, it's become a little bit more obvious.
Okay.
So because I do modelling and acting as well, it's really important that obviously that I take care of my face and things like that are just kind of eliminated, and also it's for like my confidence as well. It does have an effect,
Yes.
like on my personal confidence. So it's this area under here and there that's very hollow, and I've come in for the tear trough treatment.
Actually treating the tear trough, which is this little area under the eye. So it starts here.
Yeah.
And travels down. This is your tear trough. Actually, most of us are a little bit hollow in the tear trough. We are supposed to be a tiny bit. Some of us just have a much more deeper aesthetic, and so it tends to give us a look that gets comments like, did you sleep? Are you tired? Is that anything you can relate to? Yeah, okay. Yeah, I hear that a lot. When we just reduce the amount of hollowing there, it does give a more sort of brighter, refreshed look, and keeps those weird comments at bay as well, which you know can actually drag people down when they're actually feeling great.
Yeah,
so
it does.
Yeah. Okay, all right. So should we do something about that for you?
Yes.
Excellent. Okay, so I'm going to start on your left. So that's a really good improvement, and I would say probably in about somewhere between 6 and 10 months time, you could do an additional 1 mil split between the two sides, just to do some very minor touch-ups to perfect.
Yeah.
But that is the maximum amount you could have in one session.
Okay.
And actually it's achieved an awful lot for you, so that's
Great.
really good.
That's great to hear.
Right.
Yeah.
There we go. You keep in the mirror, you can have a little look.
Oh wow. My goodness, that's just so much better. Wow. It's really, and I can see you've really sorted out like the lines there as well that were coming. Yeah, that's lovely. That's that's really nice.
Good. I'm glad
That's
you're happy.
lovely. Very, very happy, yeah. That's lovely. Thank you so much.
Fabulous, fabulous. It's been a pleasure.
Thank you.
Hi Emma.
Hiya.
So, all right, you had a little bit of an interesting journey during the last 2 weeks since I did your tear trough. So just tell me a little bit more about that.
Well, it looked fantastic, firstly. After the next day after I had it done, it was obviously swollen, but I took the Benadryl, it went down and it actually looked amazing. I worked, I think maybe 3 days after, 3 to 4 days after, and that was for like some filming and stuff, and it looked really good. I think 2 days ago I woke up and there was just a little bit of swelling and like puffiness. I wasn't sure, it could have been like lifestyle, maybe I used my jade roller a little bit too hard. Yesterday it went down and today it's significantly decreased, but apart from that it's been really good. My confidence has just kind of really improved and I feel a lot happier actually. Yeah.
Oh,
Very
wonderful.
happy. Yeah.
Okay, so overall, that's actually very good.
Yeah.
A couple of things that you mentioned which are really interesting, and I think our viewers would be very keen to sort of get into a bit more. First of all, you mentioned that this swelling, it sort of appeared really quite late in your healing journey.
Yeah.
So typically, I would see people at 2 weeks for their review or follow-up whenever that's needed. Now, that is actually perfectly normal. During that time, actually all sorts of things happen. Your body starts on this path to building collagen around it, doing all these things. The filler itself is just a gel, and actually it will just sort of slowly melt in. Also, it's something new that's been introduced into the body, and we just finished rummaging around in your tissue, so actually we've induced a little bit of trauma there as well. Yes, you get some swelling, usually the morning after it sort of peaks. If you're very lucky like yourself, you know that it's really hardly anything to notice at all. If you are sort of massaging the face, whether it's with a roller or by hand, after having a recent treatment, yes, it can just provoke a little bit of weird swelling because of that recent trauma. It's not fully resolved. Things inside are still a little bit, you know, on their way to healing, but it died down very quickly as well. Yeah. So thank you so much for watching, guys. I hope that's been useful for you. If you've enjoyed it and you want to see more, please consider subscribing to our social media channels.